Hi, I'm Dr. Sanjeev Sokalingam, a psychiatrist and obesity medicine physician in Toronto, Ontario at the University of Toronto and scientific director for Obesity Canada. I want to emphasize the importance of a multifaceted approach to our patients who are living with obesity. I think it is clear that obesity is a chronic medical condition. There are multiple causes, which is why assessment is so integral to what we do. For the patients in front of us, many of them may have genetic, other medical or physical health issues, mental health and psychological conditions, as well as behavioral and environmental factors that can contribute and perpetuate challenges in living with obesity. And so we know that for each patient, there are a myriad of factors, but not identical factors. It is definitely something that cannot be boiled down to eat less and exercise more. And so that's why a multifaceted approach is so important to the care that we provide our patients within our clinics and clinical contexts for people who are presenting for treatment of obesity. So personalized and a multifaceted approach for each patient living with obesity should include consideration of what treatments we may be able to propose for patients and offer in our clinic based on clinical practice guidelines. And those three pillars are behavioral and psychosocial interventions, pharmacotherapy, and metabolic and bariatric surgery. And so we can consider how behavioral and psychological interventions can target and include behavior change, engagement of patients, and trying to help support their motivation and ongoing changes within their life. It can also address things like disordered eating or psychological distress, which may also be complicating treatment. Secondly, in pharmacotherapy, we know that patients respond differently to drugs, and there are some drugs based on comorbidities that we're also trying to treat, side effects, and challenges with adherence that we might need to personalize our treatments for pharmacotherapy and tailor it to our patients. And then lastly, for metabolic and bariatric surgery, we have a range of different types of surgery, some with different efficacy, post-operative care, and factors related to their response that we need to consider, again, thinking about comorbidity, their other physical health consequences and side effects, and their ability to engage in long-term treatment and adherence to the post-operative protocols. So thinking about these factors, we are still learning about these predictive factors as part of precision medicine, but this is where the area of research is going moving forward.